ED treatment breakthrough. Say goodbye to erectile dysfunction. Hey guys, welcome to our channel. You know, in my practice I talk about a lot of different health concerns, and one that comes up time and time again is erectile dysfunction. It's more common than you think, impacting millions of men, and it can really put a damper on your confidence and relationships. The good news is that there are always new advancements in medicine. And today we're going to talk about a real breakthrough in ED treatment. We're going to break down the science behind it, discuss how this new method works, and I'll share some incredible success stories from patients who have benefited from it. Remember, knowledge is power, and understanding your options is the first step to reclaiming your vitality. Stay tuned because we're about to dive into some really important information that could change your life. Latest medical research, understanding the science. For years we've known that ED can stem from a variety of factors, both physical and psychological. It could be due to things like stress, anxiety, certain medications, or even underlying health conditions like heart disease or diabetes. Now, recent medical research has really honed in on a specific aspect of ED blood flow. See, for a man to achieve and maintain an erection, you need healthy blood flow to the penis. And what researchers have found is that sometimes this blood flow is compromised by something called endothelial dysfunction. Think of your endothelium as the inner lining of your blood vessels. When it's not working properly, it can't signal the blood vessels to relax and expand, which is crucial for that rush of blood needed for an erection. This is where the latest breakthrough comes in. Scientists have been hard at work developing a new treatment method that specifically targets and improves endothelial function. This isn't just about masking the symptoms, it's about addressing a root cause of ED. In the next chapter, we'll explore exactly how this new treatment works, so keep watching. Treatment and are experiencing incredible results. Real people, real results, success stories. There's nothing more powerful than hearing from people who have struggled with a health issue and have finally found a solution that works. So let's talk about some of the success stories we've seen with name of treatment. One patient, let's call him John, had been dealing with ED for years. It was affecting his marriage, his self-esteem, everything. He tried pills, but they didn't agree with him, and he was hesitant about more invasive options. Then he came across name of treatment. After just a few sessions, John started noticing a difference. His erections were firmer, he felt more confident in the bedroom, and his relationship with his wife improved dramatically. He told me it was like a weight had been lifted off his shoulders. Another patient, Mark, was dealing with ED as a side effect of medication he was taking for another health condition. He was worried he'd have to choose between managing his health and having a fulfilling sex life. But after undergoing name of treatment, he was able to regain his sexual function without having to switch medications. These are just two examples of the many success stories we're seeing. Men from all walks of life with different causes of ED are finding lasting relief and improved intimacy thanks to this breakthrough treatment. Your health, your conversation, talking to your doctor. I know that talking about ED can be uncomfortable. Believe me, as a doctor I've had my fair share of these conversations. But it's so important to remember that ED is a medical condition just like any other. There's no shame in seeking help. If you're struggling with ED, the first step is to schedule an appointment with your doctor. They can help determine the underlying cause of your ED and recommend the best course of treatment for you. When you go to your appointment, be prepared to discuss your symptoms openly and honestly. Your doctor will likely ask you about your medical history, any medications you're taking, and your lifestyle habits. Don't be afraid to ask questions. This is your health we're talking about, and you deserve to be informed and involved in your care. Ask your doctor about name of treatment and whether it might be a good option for you. Remember, you're not alone in this. Millions of men experience ED, and there are effective treatments available. Taking that first step and talking to your doctor is crucial. Beyond treatment, lifestyle changes for better sexual health. While name of treatment is showing incredible promise in treating ED, it's important to remember that a holistic approach to your health is always best. That means incorporating lifestyle changes that can support your overall well-being, including your sexual health. First and foremost, let's talk about stress. Stress is a silent killer, and it can wreak havoc on your body in countless ways, including your sexual function. Find healthy ways to manage stress, whether it's through exercise, meditation, spending time in nature, or talking to a therapist. Next, up diet and exercise. What you put into your body matters. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean protein, and get moving. Regular physical activity improves blood flow throughout your body, including to the penis. Sleep is another crucial factor. When you're sleep deprived, your body produces less testosterone, which can impact your libido and erectile function. Aim for 7 to 9 hours of quality sleep each night. And finally, if you smoke, quit. Smoking damages your blood vessels, making it harder for blood to flow where it needs to go. Your heart, your lungs, and yes, even your penis will thank you. Take control of your sexual health. So there you have it, guys. We've covered a lot of ground today, from the latest medical research on ED to a groundbreaking new treatment option. Remember, ED is a common condition, but it doesn't have to control your life. If you're ready to explore your treatment options, I encourage you to schedule an appointment with your healthcare provider. They can provide personalized advice and help you make informed decisions about your health. And as always, if you found this video helpful, give it a thumbs up, subscribe to my channel for more informative content, and hit that notification bell so you never miss an update. Until next time, stay healthy and keep the questions coming.